Welcome to another Hospital Rounds video. I am excited to be here at Hillsdale Medical Supply for today's video. In every hospital, nurses and doctors have to round on their patients to ensure timely care and keep their patients up to date on their care plan. In the same way, we are rounding other different facilities and units in our healthcare system to keep you, our community, in the know and up to date about what's going on in Hillsdale Hospital and healthcare in your county. Today, I'm here with Kelsey Marshall. I'm excited to talk to her a little bit about Hillsdale Medical Supply. We are in our beautiful new facility. We moved here last June and had a little bit of an open house that was very fun. And this is just such a gorgeous place. The equipment is just incredible and just such a lovely space to have this business in. So, Kelsey, can you share a little bit about yourself, what you do here, and then talk to us about Hillsdale Medical Supply?
Yeah, I'm Kelsey Marshall, coordinator at Hillsdale Medical Supply. We provide supplies for patients that are going to their homes, usually from the hospital. Some patients just walk in and find new supplies here. We have lots of new supplies.
Okay. So it's a walk-in, but also, so you can walk in and buy things, but it's also on order and through kind of a referral system, which we'll talk about soon. But tell us a little bit about the types of supplies and the services that you work with to equip patients for their care journey.
So we have numerous different types of supplies. We have CPAPs, oxygen, walkers, bone stimulators.
Okay. Yeah, so services that a patient might be receiving at the hospital or at a clinic, and they might need something from Hillsdale Medical Supply. What are some examples of those services?
So we work closely with almost all of the clinics here. We work with the Orthopedic and Spine Center for the bone stimulators. We work with multiple different clinics doing continuous glucose monitors, oxygen setups.
Okay. Yeah, and the wound care, I know, is a big one, right?
Yep. We work with the wound care clinic, and we have wound care supplies and wound bags.
Okay, perfect. And podiatry, what do you provide for that?
So for podiatry, we provide boots, so ankle walkers, different types of ankle braces.
Okay, and that's part of orthopedics a little bit too, right? You might provide braces and things for that as well.
Yes.
Okay.
Yep.
Yeah, and this facility is located at 2966 West Carlton Road. It's right in front of the movie theater, very local, right around the corner from the hospital and those other clinics, so easy to access. Kelsey, one last question. What kind of experience do you really want patients to have when they're receiving their equipment here at Hillsdale Medical Supply?
We want them to have a positive experience, feel cared for, and get all of the supplies that they need.
Yeah, and I know that you work very hard to make sure that those patients know how to use the supplies and are well equipped and taken care of very well. So thank you for the work that you're doing. This is obviously a beautiful space and you have a wonderful team.
Yeah, thank you.
Now we are here with Tabitha, who is an office assistant at Hillsdale Medical Supply. Welcome, Tabitha. Can you introduce yourself and what you do here to our community?
Hi, my name is Tabitha June. I am the office assistant here at Hillsdale Medical Supply. I greet customers as they come in. I help assist the rest of the department in different areas as far as CPAP, oxygen goes.
Yeah, perfect.
That's really it.
Wonderful. Tell us about referrals. So this is something that most patients need when they come in, unless they're just coming in to browse and to maybe get some equipment that will help them on their care journey. If they have a script or some sort of referral prescription from their provider, how does that get over to you? Do they have to bring it in? Does the provider send it? And how does that work?
Okay, so they can come in the door with a script from their doctor, or they can have the doctor fax.
Okay.
Their
so either way.
Over either way. If it's faxed over, we give them a call and let them know that we got their script.
Yeah. Okay.
When they come in, we help them fill it if we have.
Yeah.
If we can, if not, we do send them elsewhere.
Okay. And most of that is just walk in,
yeah.
right? So they don't need an appointment to come in.
No appointment needed.
Unless you're getting fitted for a CPAP or something like that. It's just to walk in. And then I know we have a lot of different options for some pieces of equipment. So once a patient gets a referral, can they come in and maybe try some of that equipment out? Like if it's a walker or something like that? Okay.
Yep, so they can come in and see which one fits them best.
That's great.
The scripts are a little tricky as far as if it's bariatric or
Okay.
not. Other than that,
But you can walk them through it. It's
yeah,
very simple. That's
absolutely.
great.
Yeah.
That's wonderful. I'm excited to introduce Jade. She is one of our durable medical equipment representatives. Thank you so much for joining us, Jade. Can you introduce yourself and what you do here?
So I'm Jade. I do all of the CPAP and BiPAP fittings here and with the mask and CPAP supplies.
Okay, great. So CPAP and BiPAP, that's specifically to treat sleep disorders, correct?
Yeah.
So how does a patient come to that, come to a diagnosis that would lead them here to you to get set up for that?
So sometimes how it starts is, they have snoring, daytime sleepiness, and stuff like that. And then they'll go to their doctor and then are referred to the sleep lab.
Okay.
So then they get a sleep study.
And that's in the hospital
Yep.
usually? Okay.
Yep. And then they'll go through pulmonary at the hospital and then they'll send the referral to us. And once I get it, I call the patient, we get them scheduled, and they come in for a setup.
Okay. And you mentioned CPAP and BiPAP. Can you tell us the difference between those and nebulizers, and what kinds, like what would lead you to recommend each different piece of equipment for a patient?
So the CPAPs usually are what patients are started out with.
Okay.
You can be started out with a BiPAP depending on your diagnosis, but CPAP's going to be just one continuous pressure that goes to your airways to keep them open while you're sleeping, so you don't have those episodes of apnea, which is when you stop breathing.
Yeah.
And then the BiPAP is going to be two pressures, where the one for when you inhale, it's going to be a little higher to help keep those airways open again. But then it has a pressure for when you exhale. This is for comfort and to help with ventilation.
Okay. So that root problem of sleep apnea that's so often causing issues with sleep or disruptions with sleep can kind of be solved at the root. That's great. Tell us about this. What is the process that you go through with a patient when they come in? How do you show them how it's set up? Can you walk us through that?
Yeah. So when the patient will come in, we'll get their machine all ready before they get here. So whatever the prescribed pressure is, we'll put in.
Okay.
And then when they do get here, we kind of just walk them through the machine. So like on this side, you have your water chamber, which this is, we recommend distilled water only. It's just to help with humidification in the air, so that way they don't have dry nose, dry mouth, and things like that.
Great.
And then the filters to kind of just help filter out, dust and stuff like that, so it doesn't get into the machine. This is all they are.
Okay.
And they get changed every 2 weeks. They don't have to go in a certain way.
And do you provide replacements for that as well? Okay.
So all the supplies we provide replacements for, and those are based off what your insurance allows.
Okay.
If something does happen, we do usually try to do what we can do, so that way they don't have to go without.
Okay, great. And then how does it connect to the mask?
So there's a spot on the back of the machine.
Okay.
Where your tubing goes on. This is just our regular tubing, so it kind of just slides over.
Yeah.
And then it'll slide over on the end of your mask as well.
Really easy.
Yeah.
It seems like.
Try to make it as simple as we can.
Yeah. So if patients are needing to get set up with this and they come in, you kind of walk them through it. I'm assuming some of the time they're a little bit nervous about starting to use this equipment on their own, making sure they do it right. How do you kind of reassure patients through that process and equip them to feel confident in that?
So a lot of the time I just try to reassure them, a lot of people have these. They all start somewhere. You're not going to win a beauty contest in the mask, but it's to help you sleep. So that way, you feel better. A lot of people say, I don't get to live my life that I want to because I'm tired all the time and feel like I just don't get rest.
Absolutely.
So we try to walk them through, once you have this and you're used to it, I promise you will feel better.
Yeah.
And just let them know every step of the way we're here.
Yeah, that's so great. I'm happy to hear that it's such a collaborative process. I know that you're so supportive of our patients, and we appreciate what you do here.
Oh, thank you.
Lastly, we are going to talk to Logan. Thank you for being on the video, Logan. Can you introduce yourself to our community and what you do here?
Okay. My name is Logan. I'm here with Hillsdale Medical Supply. I'm the delivery technician. I take care of home oxygen, oxygen delivery, and many other things.
Perfect. So let's talk about drop-off first. Once a patient has their oxygen and their oxygen tank is empty, where do they bring it? How do they drop it off?
So we typically ask you come around to the back of the building.
Okay.
We have a little button in the back there. You just push it and someone will come help you. You bring your empties in and we'll help you take we'll help you
Perfect.
take care of it.
And there's signs on the door to tell you the hours and things like that, but it's just running around the back of the building. And let's talk about getting the oxygen. So once a patient knows that they need oxygen, how does that work with the home delivery process?
So once a patient knows they need oxygen, we typically get a fax from the hospital, and we know ahead of time that this patient is going to be needing a setup.
Okay.
So we will coordinate with the hospital and the patient if they're, in the hospital for a long period of time.
Okay.
We have to wait for them to get discharged, and once they're home, we'll call them, make sure that they're home and ready, and we will go to their house, or I will, and set them up with a concentrator and a couple of spare tanks, and
yeah, that's pretty simple. And then the patient doesn't have to really worry about the process.
No.
If something breaks, like if their concentrator, which you see back here, or something else breaks, what do they do?
So if something breaks, no matter what time it is, someone is always available here for them to, go to their house, diagnose the issue, bring a spare just in case. After hours, you call the hospital, and during business hours, 8 to 5, you call our number and we'll come running.
That's great. And that's no extra fees or costs or anything like that, correct?
Nope.
Okay. So it's all included. And Hillsdale Medical Supply does accept most insurances, including Blue Cross Blue Shield, Medicaid, Medicare. There's a list on the website, I believe, but most insurances are accepted. So thank you, Logan, for what you're doing for our community. I know that patients really appreciate not having to drive every time they need oxygen. That's a huge help.
Yep, absolutely.
Yeah. And thank you, our community, for joining us for this video. If you want to learn more about Hillsdale Medical Supply, visit hillsdalehospital.com/supply, or you can call the number that's on the website, and we'll put that in the caption as well. Thank you again. We'll see you very soon for another video. And until then, remember, rural health strong.